I've done Botox, filler, peels, and lasers. Why do I still look tired in photos and on Zoom? Tiredness is usually a combination of a lot of things that you have going on. There's different things that go into aging. You have structure, volume, skin quality, specific things about your eyes. And if you only treat one thing, the others will tell on you. I will unpack these layers of looking tired, how you can decide what combination of things that you need so you can look your best and refreshed. So there's 4 things that go into aging. One is going to be gravity. So I think that's the one that we all think of the most. We think, oh, over time, things just kind of come down and you can see the jowls and you can see the neck and you can see how things just descend over time. And that is because of gravity, but it's also because of the other aspects of aging. And that one would be structure. And so that is your actual bony structure changes over time. You lose bone around your eyes, around where the nerves come out, in different parts of the face, which can cause the face to descend because you don't have as much holding it up. And then the tissue itself isn't as strong, and so that is descending over time. You're losing volume, and so the soft tissue, which can be your skin, your fat, and like I said, even the bone changes over time, so you just have less volume. You notice in babies, their faces are nice and round and plump and cute little cheeks, and then over time, they kind of thin out as they grow up, and then as we have more birthdays, it thins out more and more. And then you have the skin texture, actual quality. So that's your brown spots, your fine lines, your texture. A lot of that is affected by sun exposure or even just somewhat genetics and that volume loss of having a grocery bag that's full of groceries and then you take the groceries out and then you will have more of the lines. So they all kind of play in together. Is it gravity? Is it the structure? Is it your volume? Is your skin? Is it all of the above? And with most people, it's all of the above, just in varying amounts of each. And sometimes when you go into places like med spas, they just like to sell you a package. They say, we have this laser, the laser will be great. I see you have some brown spots, this BBL will take care of it. Or come in and they say, oh, we can do some filler. And I used to see this a lot. People are a lot more educated now, and so I'm luckily not seeing it as much. But oh, well, we'll just keep doing filler and it'll lift your face and I'll put more in your cheeks and it'll lift everything up. And then 12 syringes later, you still have jowls, you still have nasolabial folds, and you've got these cheeks that you never really signed up for. So I'll give you a map of things that you can do in a mirror so you can figure out, kind of what's going on. One is just look at your skin. What does the skin quality look like? This is usually pretty easy for people. Do I have fine lines? Do I have brown spots? Do I have the rougher texture? Is this something, that is more of the skin? Or is it when you look at yourself compared to before, are you seeing more of the hollowing of your cheeks? Are you seeing you feel like this part of your chin used to be filled out more. Your temples are a little bit more indented. You're seeing and especially like around the mouth, you'll see more of the little vertical lines. Almost 100% of the people that I see with the little vertical lines, they'll say, oh, I never smoked. I was never a smoker, because we call them smoker's lines. But for the most part, it's volume loss around our face, not necessarily smoking. Smoking doesn't help, but it's vast majority of people never smoke, but it's more of a volume thing. Are things descending over time because that structure isn't there, that the integrity of the skin isn't quite as good, and so it's sagging over time? The soft tissue, you're seeing the nasolabial folds, the marionette lines, the laxity in the neck. Ask yourself, am I mostly a skin, a structure, or gravity, or volume loss right now, or a combination of those? So whenever you go in and you talk to someone, you'll have an idea of, okay, this is what I think is going on with my face. And so whenever they give you their assessment, does that align with what you're thinking? And that way you can have more of a collaboration with whoever's taking care of you of what is going to be the best for you. If you look in the mirror and you say, yeah, I'm just this volume, I'm seeing this little hollowing, I'm seeing my temple, then volume replacement makes sense. That means fillers make sense. If you're seeing the skin texture that's changing over time, then the lasers will make sense. And if you're seeing this descent and they're telling you need more volume, maybe that doesn't make as much sense that a skin tightening or a facelift would make. So being able to really kind of tell what's going on with your face, what that means, what the aging is happening, and then align that with what person that you're seeing is telling you, and then be able to make that plan over a year or 5 years. Or, okay, we can start with some Botox, we can start with some lasers, but maybe to address the lower face, a facelift is really going to be what makes the biggest difference for you. So you can make an educated decision on the treatments that you do and what will look best for you. So if you have other other questions, let me know, or you can schedule a consultation at drangela.sturm.com.